Hi, my name's Hannah.
And I'm Lydia.
And we're part of the Erlanger Inpatient Wound Ostomy team. And today we're going to be talking about basic pressure injury interventions. We're going to be talking about basic skin assessment, offloading, Mepilex application, early interventions, and how to consult wound care.
Alright, so I'm going to start us out with a skin assessment. And the big takeaway from this is I know you guys are super busy out there on the floor and ICUs, but you can do a quick and thorough skin assessment in about 90 seconds. So I'm going to start by uncovering the patient. I've already got the bed, the level. That's going to be easy for me to turn the patient. A lot of times for me, I'll drop my rail down. And if you bend the patient's knee that is on your side and take the arm that is also on your side and take it across the chest and turn away from me, their body naturally wants to go in this direction. So when I've got them here on their left side, I can see both heels, I can see both ischium, their sacrum, their buttocks, both scapula, their occiput, and their right elbow. So this is a quick way to get your assessment done. And remember, when you are checking out these sites, you want to make sure that you're checking for if the skin blanches or not. And that's when you press on the skin over the bony area, the color goes away and comes back. If it does not come back, you need to let us know because that likely signifies the patient's developing a pressure injury. And then when you turn back to the other side, you're going to be able to hit the other elbow and the scapula if you were able to miss it. Or what? That doesn't make any sense. If you miss it.
If you missed it, yes. Skin assessments should be done upon admit and transfer in the hospital, as well as at least,
Every shift.
At least every shift. In addition to turning, this is a good opportunity for offloading. Offloading is the most important part of our pressure prevention. What it does is it redistributes the blood flow to different parts of the body. So we want to be turning our patients about every 2 hours so that we can get the blood flow distributed to different parts of the body so our skin stays healthy. What we can do to turn to stay off of our bottoms are use a wedge or a pillow. And what you want to do is you want to turn just like you were doing a skin assessment, and you want to apply the wedge from shoulders to hips so that the tailbone is floating underneath here. You don't want to apply it too low, otherwise the tailbone is just under something hard, and that can cause even further pressure. If this is too much, if your patient's not wanting to be turned over with the wedge, you can also use a pillow in the same way by placing it from shoulder to hip to hopefully get a little bit of offloading on the tailbone. And with heels, thank you, we want them to be off of the bed because our heels don't have a lot of subcutaneous tissue or anything cushioning them. So when we are lying flat in the bed, they're at a huge risk for pressure injuries. So we can either float them using a pillow, and how you want to do this is you want to make sure that the pillow is nice and rolled up so that the heel is floating in air. There's nothing under the heel to cause pressure. If we have boots available, you can use these as well. You just want to make sure that your heels are in the base of this boot and not riding up on the fabric as well. So whenever you boost or adjust, you want to check your heels to make sure that they're where they need to be.
And that means physically sticking your hand in there to make sure that their heel is in that divot in the boot, because this, and if I tighten it, this looks like their heel is not in it, but I know that it's not in it.
Yes. So offloading is the most important part of pressure injury prevention, but we also have really good foams that we can use that also help reduce friction when we're moving and positioning in bed as well. So the first one that we have is our heel foam. This helps to prevent friction on the bony prominences of our heel. So it looks like this. What we do when we apply these is I take the middle panel off. The thicker sides are meant for both sides of the ankle, and then we put the base of the heel right in the center here. So I apply it like this. And then these smaller flaps kind of fold around the edges here. Make sure that's nice and smooth, and you still want to offload the heel. When you're doing your skin checks, you can take the flaps, and kind of draw the dressing down. Look at the whole heel, both inside, outside, and back. and then gently reapply. These can last about 5 to 7 days, and they can be peeled back and reapplied many, many times. And you still want to offload.
And I believe now in Epic there should be a place where you do in your drop-down box, I think on cares and safeties, where peel back Mepilex or peel back sacral Mepilex or heel Mepilex, whichever it is, but that you peeled it back and that you assess the skin beneath.
Alright.
So now we're going to apply a sacral Mepilex. So I'm going to turn our fella back. And a lot of times when we see these applied on patients, they're applied straight on and flat, so you're actually taping the patient's cheek together or getting really close to their anus. So this is for the sacrum. It should go over the sacrum and just over the coccyx. It shouldn't be up their mid-back, and it's not for their perineum. When you want to apply this, you want to pull off the middle. And I like to leave my little side flaps on so that it's easier for me to apply. So the tail up or tail down, it doesn't matter. This was originally intended for the coccyx, but I knew that on some patients who have liquid stool, it can kind of be a trough for poop to get up under it. So just for my personal preference, I like to have the tail up, but I fold it in half like that. And then I want to make sure that I'm getting it right in the center of his natal cleft. And that's where I start, like obviously with my gloved hand, but I'm going to run the center down to make sure that my center's on, and then I will start from there and push my Mepilex out, and then do from the bottom. You have to, or you should be assessing every shift. So you're going to grab these little tabs. To be honest, I probably don't ever grab the bottom tab. I just grab up here at the top. And I gently peel down with even pressure. I can see the entire area, and then I can roll it back up. For protection, your sacral Mepilexes will usually last 3 to 5 days. If there's a little bit of stool on the outside urine, you don't have to throw them away. Obviously, if they become saturated due to incontinence, yes, throw them away. Let me see anything else.
No,
I think that's it for sacral Mepilex.
So, as you're assessing patients, you might notice things on off hours or on the weekend hours, and you're seeing issues with the skin, but you know you want to consult wound care, but you're needing interventions now. There is a place in the order set that you can use for early wound care interventions. It's in the order set 105. There you'll have, turn interventions, offloading interventions, and things like that. And then as far as consulting wound care, you do that through orders as well, through Wound Care Eval and Treat. And there you'll consult us, let us know what's going on, and then we will be out to see the patient pretty shortly.
And it does say wound ostomy eval and treat. If you say like wound care or wound care for dressing changes or any of that, wound ostomy eval and treat is the only one that reaches us. And just to touch on what Hannah said about order set 105, this is the same place where you find interventions for skin tears, for abrasions, for blisters, for open wounds. We've recently updated, I want to say our pressure injury prevention protocol that should be out there on the internet, and the order set 105 that lets you know what to do in these situations when we're not available. As bedside nurses, we've both been bedside nurses, but our responsibility as far as wounds, when we're not in the wound care mode, is to keep a wound clean and covered. That's all that we ask. We don't ask anything, special or crazy dressings, just for you to cover it, document it, and let us know that it's there so that we can assess it.
In addition to our consults, we're also available through Secure Chat, and our extension is 7032. We're here Monday through Friday, 8 to 4:30. Let us know if you guys need anything.